If you're in any kind of pain like that, or you're constantly bleeding, which means you're constantly worn out, it's definitely, it doesn't hurt to ask about it.
Now let's talk about some of the causes of abnormal bleeding. The first thing that I'd like to emphasize is that when you're speaking to your provider about abnormal uterine bleeding, it's very important that you get a chance to explain exactly what's going on and that your provider takes a complete history and does a good physical examination. Even with all the sophisticated tests we have today, the most important things that we do still involve listening to patients and doing a good exam.
So whenever a patient comes to me with abnormal bleeding and I start to do an evaluation, I'm pretty much thinking about one of two possibilities. Either a structural problem, some sort of a growth within the uterus, such as fibroids or polyps, which are very common, or some sort of hormonal imbalance, which is making the lining of the uterus disordered and making the bleeding unpredictable. With regards to structural problems, fibroids are an extremely common source of abnormal bleeding. As many as 30 to 70% of women have fibroids, but not all fibroids cause abnormal bleeding. If they're just big enough or located just in the right spot to interrupt the lining of the uterus, they're notorious for causing abnormal bleeding, and aside from cancers, the most common reason for abnormal bleeding amongst most women.
Polyps are small glandular growths that occur in the inside of the uterus. They are generally benign and not cancerous, but they are often associated with abnormal bleeding. Any woman who has postmenopausal bleeding of an unexplained source needs to bring it to the attention to her provider, no matter how minimal or infrequent that bleeding occurs, because endometrial cancer is a fairly common cancer in postmenopausal women and can be treated and cured in most cases. So it's very important to bring postmenopausal bleeding to your provider's attention. Now let's talk about causes of abnormal bleeding that are not related to abnormal growths. The most common are related to hormonal imbalances. We see these often in patients who are on a birth control pill or who have ovulatory issues and don't ovulate every month. Other common causes include infections and bleeding disorders. Among the most common causes that we see is adenomyosis. Adenomyosis of the uterus is similar to endometriosis, where there is an abnormal growth of endometrial lining cells. Endometriosis is when the endometrial lining cells populate the pelvis, and adenomyosis is when these cells grow into the muscle layer of the uterus. This is most commonly seen for women who have abnormal bleeding after childbirth, and it is often not responsive to being treated with birth control pills. Endometrial hyperplasia is another condition that's commonly associated with hormonal imbalances. Endometrial hyperplasia is an abnormal thickening of the uterine lining, and it may be a precancerous condition, and so it should always be thoroughly assessed and diagnosed.